Hi, I'm Sue Kwolek, Vice President Patient Services and Chief Nursing Officer and Executive Lead for the St. Catharines site, Niagara Health System. The patient move to the new site is a very complex one. We expect to move approximately 230 patients in slightly under 6 hours. Our number one priority is patient and staff safety. We will be working with our partners, healthcare relocators, who have a significant amount of experience moving hospitals similar to ours into new facilities. A complex move such as ours requires significant amount of planning to move both patients, staff, equipment, and hospital belongings to the new site. We need to include all our staff, physicians, and volunteers, as well as our communities, to engage in the move. During the move, we will be having a 15-day move sequence prior to March 24th, 2013. All 4 sites will be moving during this time in phases prior to the patient move day. And during those 2 weeks, we will be reducing our census so that we can alleviate pressure on our resources. All patients will transfer to the new St. Catharines site on patient move day. We will maintain urgent and emergent services throughout the entire move project. And we need to make sure that the community is aware of our new model of care and has awareness of the moves that are happening. On March 24th, our exciting move day, we will be at the new site very early in the morning. At 6 a.m., the emergency department of the St. Catharines General Site will close and the new St. Catharines Site Emergency Department will open. At approximately 7 a.m., there will be several streams of patients who will travel from St. Catharines Site, the Welland Site, and the Greater Niagara Site to the new St. Catharines Site. Mental health patients will be one of the first patients to come over to the new site. Ambulatory patients, EMS patients, and patient transport will follow. In order to execute a move like this, there will be a command center. The command centers will be located at the Welland site, at the Greater Niagara site, at the Legacy St. Catharines site, as well as the new St. Catharines site. The purpose of the command center is really to provide planning, execution, and problem solving of the actual move activities. In the command center will be an incident manager who has overall accountability for the move, a public relations officer, risk officer, security and safety officer, a family information center officer, an operations chief, and a logistics chief. Everybody plays a role on that important move day. While staff and patient safety are our number one priority, families also play an important role on our move day. Our patients' families will be integral to move day preparation and our patient experience during the actual move. Families will be met on the day prior to the move by the manager or designate. They will be asked to remove all unnecessary belongings from the patient's room to ensure we lose none of their items. We are asking families to remain at home during the move to allow the move team to dedicate their time to the patient's needs. And once the patient is settled in the room, a volunteer or the ward secretary will contact family members so that they can visit their family member in the new facility. So you might ask, who's going to be on site on that important day? On site will be site leadership, corporate administration, all the clinical supports, and support services necessary to care for our patients. I'm really excited about the move to the new St. Catharines site. I hope you'll join us in celebrating our move and that we have a wonderful move experience.